I, Anna Whetstine, consent to be in Sarah Whetstine's video.
I'm going to perform hand hygiene. Hi, I'm Sarah. I'm going to be your nurse today. Are you Miss Whetstine?
Yes, ma'am.
Okay, can you state your full name and date of birth for me?
Anna Mae Whetstine, July 23rd, 2000.
Awesome. Thank you so much. I'm assessing for her breathing while I'm talking to her right now, and she is not labored breathing at a nice, even, normal pace, having equal chest rise. Can you tell me what year it is?
It is 2020.
Can you tell me who the president is?
Donald Trump.
And what state are we currently in?
Texas.
So I am testing her cognitive level of, who she is. She already told me. The place, where we are, and time, we're in year 2020. If I wanted to be more specific, I'd ask her what month it is. Okay, I'm also going to assess her circulation throughout her body. So looking at her skin is dry, well, moist dry, and is warm to the touch. She has equal capillary refill on her fingers. So that means that she's having good circulation throughout the body. Her face is not pale or showing any signs of cyanosis, and so she's having adequate circulation throughout her body. Now I'm going to take some of her vital signs, starting off with blood pressure. So, Miss Whetstine, I'm going to place this sphygmomanometer on your arm. I'm going to have you face your hand up, just relax on the bedside. It's going to get slightly tight. If it becomes too uncomfortable, I just want you to tell me and I'll release it. Okay. So I'm going to place my stethoscope on her brachial artery and pump up my meter. Her blood pressure is 122/74, which is in normal ranges. Now I'm going to assess her pulse rate and her respiratory rate right after. So I'm going to find her radial pulse, which is on the thumb side of her hand. Her pulse rate is 90 beats per minute. Now, while keeping my hand on her pulse, I am going to assess her abdomen or chest wall for chest rises to monitor her breathing. She's breathing at a rate of 16 breaths per minute, which is all within normal limits. If I had a pulse oximeter, I would now place it on her to make sure that she was getting adequate oxygen to her body. So since her vital signs are normal, I'm now going to move on to what the primary reason she is here for. So Anna, do you have, Miss Whetstine, do you have any pain on your body right now?
My right ear has been hurting.
How long has your right ear been hurting?
About 3 days.
3 days. When did you start to notice it hurting?
While I was in the shower.
While you were in the shower. Have you been swimming recently?
Yes, ma'am.
How often do you say that you swim?
About twice a week.
And on a scale of 1 to 10, how much does your right ear hurt?
About a 4.
A 4. Have you taken anything for your right ear?
Swimmer's ear.
Have you ever had any kind of issues with your ears before?
Sometimes water does get stuck in there.
Yes. Have you ever had tubes placed in there whenever you were a child?
No, ma'am.
Okay. Well, now I'm going to look into your ears, okay? So, I'm going to look into your left one first that she says is normal. Okay. That one looks good. Now I'm going to look into her right ear that she says she's having issues, and I see a little redness. Okay, so I'm going to continue with the examination. I'm going to look and check for any tubes or equipment, and I don't believe Miss Whetstine has any tubes or equipment on her. Now I want to assess her heart rate and her breathing. So first, I just want to do a visual over the chest, make sure that the chest wall is rising at an even, symmetrical pace, which it is. She has no skin redness that I can tell, and the skin is warm and intact. So if you could sit forward for me for a second, and I'm going to listen to your breathing. Okay. And take a deep breath in. Breathe out. Deep breath. 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 Breathe out. Okay. She has normal breath sounds, no rails and no crackles. You can go ahead and sit back for me. Okay, now I'm going to assess her chest. Is there any pain whenever I palpitate?
No.
No. None at all?
No, ma'am.
Okay. So now I'm going to listen to the heart sounds. And she has normal heart sounds, normal rate and rhythm, and there is no heart murmur. Now, Miss Anna, do you have any allergies?
No, ma'am.
Do you have any drug allergies?
No, ma'am.
And are you currently on any medication?
No.
Okay. Now, if you could scoot down a little bit, I'm going to do an assessment of your abdomen. Okay. So I'm just going to lift up your shirt a little bit to expose your abdomen. Upon inspection, there's no abdominal distension or discoloration in the abdomen. There is also equal perfusion of color, which means that there is blood flow and circulation throughout the abdomen. So first, when looking at the abdomen, I am going to listen to her bowel sounds. She has normal digestive bowel sounds. So now I'm going to percuss her abdomen. and she has normal bowel movement, bowel sounds as well. So now I am going to palpitate her abdomen. So you can tell me if there's any tenderness when I press. Okay. And how frequently do you have a bowel movement?
Normally twice a day.
Is your bowel movement normal right now?
Yes.
Okay, I'm gonna press a little bit harder now, okay? Still same thing, tell me if you have any pain. Do you have any pain?
No, ma'am.
Okay. I'm gonna cover you back up now. Okay. So, now we're going to do upper extremity assessment. So as I'm looking at her upper extremity, it is colored and it is warm to the touch, just how it should be. There's no profuse sweating, and her capillary refill is normal. Now I'm going to assess range of motion. Her fingers move perfectly fine. Do they hurt?
No, ma'am.
Your wrist, whenever I move it, does it hurt?
No.
Your elbow, do you have pain in your elbow?
No, ma'am.
And in your shoulder. Is there any pain with movement in your shoulder?
No, ma'am.
Okay, now we're gonna assess for strength in the upper extremities. So if you wouldn't mind squeezing my fingers as tight as you can. Okay, now I want you to make this like this. And I want you to push me away, pull me towards you. There's adequate strength in her upper extremities. Now we are going to assess her lower extremity. So I'm going to expose her lower extremity. I'm looking for any kind of pitting edema, any swelling in her leg and her feet. And I'm also looking to make sure that she has a strong pedal pulse, because if she has a strong pedal pulse, she has adequate blood flow from her waist down. I'm looking for, as I said, any pitting edema. I'm looking at the skin color, making sure that the skin's intact as I'm doing her lower leg assessment. I'm looking, and Miss Whetstine, do you have a normal range of motion in your toes?
Yes.
Any pain
No,
with
ma'am.
movement of your ankle?
Nope.
And then your knee and your hip?
No, ma'am.
Okay, now I'm going to test strength of her lower extremities. Miss Whetstine, can you push on my hands like you're pushing on the gas? And then go ahead and pull up. Wonderful. So she has adequate strength in her lower extremities. Throughout the exam, I was looking at her skin integrity, looking for any kind of lesions, pressure ulcers, or wounds that might be exposed. Miss Whetstine, do you have any ulcers that you've felt on your backside, on your back?
No, ma'am.
Is it uncomfortable for you to lay down on your back at any point in time?
No, ma'am.
Okay. So after I have assessed that she has healthy, moist skin, and there's no lesions, no pressure ulcers, and there's adequate capillary refill not only in her hands but in her toes as well. Miss Whetstine, and like you said, it is your right ear that is hurting you. And are you currently on any other types of medication?
No, ma'am.
Do you have any other problems that you would like to address with the doctor?
No.
Okay, well, give me a second and I will let him know that you're